I'll get us started. I'm Dr. Becky Warnkin. I'm the general chair of the Committee for Conventions and CE for the FDA. And I am here to welcome Dr. Waji Khan. He's one of our featured speakers for FDC this year, and we're so excited to get to know him before we get to see him speak at FDC. So tell me a little bit about yourself and your background.
A little bit about myself. Well, I mean, that depends how much time you have. I graduated, born and raised in Canada. So we have snow up here right now. So it's November. So I was just in Florida about 2 weeks ago, and they had the hurricane, what was that one called? Nicole roll through. I was actually down there at the New York Mets training complex in Port St. Lucie. And this hurricane came through. Anyway, so long story short, we had to leave, so I was kind of sad. But it was nice and warm in Florida. Only to come back to Canada, and it's like, well, I guess I can't. We do everything in Celsius here, so 0 degrees. So I guess that was that like minus 32. Yep. Was that 32 over here? So it wasn't too nice. So born in Canada, went to University of Toronto for my undergraduate and my dentistry degree. Graduated in 2001 from dental school. I was one of those people that joined the military. You know, you hear great stories about things we do in the military. You know, peacekeeping and world aid and all that sort of stuff. Seemed kind of, but you know, being young, dumb, and silly, you kind of get you know, a passion to let's go you know, let's go join the military. So so I joined the military, and that was a great experience. Got a lot of good training in the summers while I was in dental school. So you're not sitting there and like flipping burgers for, you know, $4 an hour. You actually go off to basic training and eat burgers that are worth far less than $4 an hour. But the rations weren't that bad. And I mean, the funny thing with the rations is that when you're actually super hungry, they taste amazing. Like they are so good. So yeah, so I got to do that. And then graduated in 2001, was posted out with the Navy. In Canada, you're not actually in the United States. You have the Marines, you have the Army, you have the Navy, you have the Air Force. So in Canada, actually, when you're a dentist, you're actually in the Army uniform, but you can go to any of the elements. So Air Force, Navy, or Army. So I was posted to the naval base and had a lot of good experiences there. Got to meet a lot of my American counterparts. Some are still, you know, friends to this day. And that was about it. And I took my release from the regular forces in 2007, got married, wife that wanted nothing to do with military service life. You know, it came down to like where you get posted and all that sort of stuff. And then at the time, I was kind of in between, you know, wanted to be an oral surgeon, but I kind of, you know, like prosthodontics and like doing all types of other things and stuff like that. And then kind of just went totally rogue. Went back to medical school, actually, because I wanted to do either ENT surgery or plastics or something artsy like that. A couple of kids later, you know, those passions start to go away, and you just kind of like amalgamate your entire, had to throw amalgamate in there. You amalgamate all your experiences and just go into like, you know, like nothing, you know, being a measly little general dentist is not a bad thing at the end of the day. Sometimes you get to sort of, you know, pick and choose the things that you like to do. In around, I believe 2012, I read an interesting paper. So being down in Florida, you guys have Dr. Robert Marks down, I think, at the University of Miami. And so, like, you know, he really was the guy that really wrote the papers back in 1998 on platelet-rich plasma. And there was a paper written in 2001 by a guy named Joseph Chacroun. Unfortunately, he wrote it in French, and I'm not sure how good your French is, but I won't speak French here because it probably sound like I'm swearing. But it was written in French, and I think, unfortunately, for that reason, that's my own opinion here. I think for that reason and the power of a name like Robert Marks, I think PRF really didn't get the attention it deserved, and we focused very much on platelet-rich plasma for probably, you know, a good, probably, you know, 10, 15 years. And PRF started to make it to come out. And I got really interested in it, started doing some research work in it and stuff and incorporating it into practice. And 21 years later, a bunch of gray hair, a bunch of kids, a couple cats, a couple dogs. And there you go. That's where I'm at. That's my story.
Awesome. I love that. I think it's awesome that you kind of have redirected and decided what you wanted to do throughout your life and kind of done all those different turns. I think that shows a lot of resilience, and that's amazing. So you kind of touched on what got you interested in platelet-rich fibrin. What really started that journey for you? Was it like a certain patient or something that you felt you needed to offer your patients? What got you on that path?
So actually what got me onto the path was a presentation I went to go see at an implant seminar. And fortunately for me, I was invited to go for dinner the night before with the main speaker. This was an interesting dinner. Oh, hopefully he's not watching this interview, because it's like, that was a fun dinner. Dr. John Julian. And he mentioned, I'm going to talk about platelet-rich fibrin tomorrow. And I said to him, I said, you mean platelet-rich plasma? And he said, no, I mean platelet-rich fibrin. And I said, really? And so many of us had PRP, or platelet-rich plasma, in our practices, but it was rather cumbersome to use it. You usually require 2 spin cycles, a lot of mechanical handling of the tubes, exogenous calcium and thrombin and other things you need to mix inside there. And so it just wasn't really practical to use in day-to-day clinical practice. And he mentioned PRF, and I said, what's this PRF? And the next day we went to his seminar, and he showed me about how he used it in practice for various surgical cases, implant cases, bone grafting, third molars, all types of stuff like that, sinus perforations. And I was like, wow, this is like really neat. And then, it's one of those things in dentistry where I always comment to people, you go out for CE, and clinicians will show you various things in practice. And then, you go back to your practice on Monday and you try to do it and you can't do it. And many times we just kind of grow accustomed into thinking that, we weren't good enough, or like, we don't sit there and ask the question. Maybe the guy was just, blowing smoke up the proverbial arse sort of thing. But, what type of charlatans are these people? But many times we just kind of say quietly, we don't say anything. We kind of say, yeah, maybe this stuff doesn't work, or maybe I'm not good enough. And that's sadly, one of the things which, from an imposter syndrome perspective, many of us suffer from, including myself, right? Like, I'll watch one of my colleagues, Ricardo Kern, who's one of the best soft tissue guys I know in the world. And he just happens to be a friend of mine. And so I'll show him like stuff that I'm doing that he tries. And he always gives me that like T-ball coach sort of like, hey, man, that was a good try. Great effort, man. Great effort. And I said, isn't this how you wanted me to do it? He's like, no, I didn't teach you how to do it like that. But I mean, that's how you learn, right? I mean, like, it's all about like, practice, go back to the material, revisit what things you were trying to study, and master what it is that we do. There's a reason we call it practicing dentistry for like, 30, 40, 50 years. We never say, oh, I mastered dentistry after 40 years, except for unless you're in the AGD, where they do have a mastership available. But going back to Dr. Julian's course, John Julian's course, so this was down in Montreal. Montreal is about a 2-hour drive from Kingston, where my main practice is. And all I remember is driving back from this, and I called my practice manager. I said, hey, where's that centrifuge we have? And she's like, it's in, every dentist has that, cupboard of like, flower pots and things like, like the air abrasion and the lasers and all that sort of stuff. Everyone's got it, right? They like the
gadgets that died,
but gadgets that they thought they were going to use, but they never used, that sort of thing. So I called her up, said, where's that centrifuge? And she's like, it's in storage over here. I said, oh, okay, cool. And then I called up one of my best friends in dentistry, Ziggy, go eat your food, Dr. Gokhan Shevkat. And I said, hey, buddy, what are you up to? And he's like, not much. I was like, bro, meet me at my office in 2 hours. I'll be there in 2 hours. He's like, is everything okay? I was like, yeah, everything's fine. And basically, the centrifuge has one of those rudimentary centrifuges. We're talking the old school Chacrun technique. Like there's, spinning it down for 10 minutes at 3,000 revolutions per minute. This, the centrifuge didn't even have a setting on it. You basically had no choice but to spin it at 3,000 RPM. And basically I said, come to the practice. And he's like, okay, what do you want to do? And I told him what we're going to do. And, put a tourniquet on him, vena punctured him, took, 2 vials of blood, span it down, looked at the result, played around with it a bit. And I was just like, wow, this is cool. This works. This is amazing, right? Like,
yeah.
And so here we are, right?
Right. That's awesome. I love that he was so willing to come in and help.
That was around 2000, 12. And then in and around 2016, 17, one of my colleagues, he's like, you do a lot of these cases and stuff, why don't you educate your colleagues about this? And you get lots of good cases and stuff that you can show. And so I said, okay, let's try to put a course or a program together whereby we can actually, educate or provide some cases and feedback and follow up for our colleagues with respect to how they can implement this in their practice.
Awesome. So what do you think, or why do you think it's so important to implement it in your practice? You've touched on all the things that you do with it, but if you were talking to a dentist that's like, oh, I don't know if I really want to get into that, what would you tell them? Why is this important and what can it do for their patients?
Well, it's a tremendous service you can provide for your patients in the sense that it's autogenous, it's safe. Unlike PRP, it's very easy to offer in your practice. We do a lot of, assuming you're doing surgery in your practice, if you're the dentist, there's nothing wrong with that. If you're the type of dentist who's not into blood and guts dentistry and, you don't even take out teeth sort of thing, you don't need to do it. Just because you can do something doesn't mean you should be doing it. But for most people who are, especially in dentistry as well, I think from the time when I graduated, this is actually a funny story. We were just talking about this the other day with a colleague of mine, and I remember being in the operating room at Sunnybrook Hospital in 2000, and at the time there was a Dr. Drover and a Dr. Tokyo. They were doing orthognathic surgeries. That day in dental school where they send you to the hospital for a week, and I was like, oh my God, you guys are doing, oh my God, what are you guys doing? And I remember in the fall talking to Dr. Jerry Collins, who's one of the most gifted clinicians I ever had a chance to work with. But, we were talking about the type of dentistry he does. And this is like literally, 3 months out of school. And he's talking about like foundation building and bone grafting and stuff. And I just kind of like looked at him like, I'm never going to do stuff like that. Right. And so sometimes I just look at the stuff that I do now and I'm just like, man, if I was talking to myself from 20 years ago and telling myself the stuff that I'd be doing today, I'd be just in shock. I'm like, is this the same guy? There's no way. It's like, I thought I'd be just doing restorations and crowns and stuff, but I think dentistry has really taken a much more surgical twist. I think, we definitely have much more of a medical focus in terms of the histories and physicals that we run for our patients before working on them. Gone are the days where, it's just drill and fill and crown and bridge and that sort of stuff. With a lot of the disease rates going down, in order to basically, have a decent practice, you kind of really have to focus a little bit more on some of this stuff. So I think it definitely supplements that for us. So it's autogenous, it's safe. The results are much better for patients. In terms of post-operative management, patients who use platelet-rich fibrin on, because remember, you're cutting someone, right? This guy's looks like he's about to cut me, but okay, you're the cat, that is, right? Like, oh, he's given me a couple of haymakers in the past. Oh boy, oh boy, oh boy. So you're cutting someone, it's a raw wound, right? So basically by putting the PRF on that wound, what you've done is kind of put a little bit of a natural bandage on. And so it's really helpful from patients' post-op pain management perspective, especially in society where we are right now, where it's kind of frowned upon to, rely upon opioids and other types of medications. Here's something that can really, add on to, like many times when patients come through with PRF, they don't even take Advil, they don't even take ibuprofen, right? Sorry, I don't want to use a brand name. Like they don't even take ibuprofen. Like they'll come back and say, "Wow, this is amazing," and patients will be like, "Oh my God, you're like the best surgeon ever." And I'm like, not really, actually. Your body is, it's not actually me. It's your body that's amazing. Whether you're spiritual or not spiritual, God's basically given us a gift, right? And we're just the sort of the carriers of that, and we try to make it happen, right? But here's an opportunity for you to not rely upon heavy pain medications for patients using PRF. And then last thing I'm going to throw in there is it's got what we call in the Army the LCF. You know what the LCF is? In the Army, everything's a 3-letter acronym, right? So the LCF stands for the looks cool factor, right? It's got the LCF, man. It's got the looks cool factor. So patients are always like, wow, did that come out of me? Wow, like this is great, right? And you always go to CE seminars and stuff, and people are like, you got to have the latest laser in your office. The patients are going to love this laser, right? And you're like, okay, so here's something you can introduce in your practice for, a fraction of the cost. There's, when we come down to the presentation, there's all different types of components and things you can buy. You can buy a Ferrari as a car, you can buy a Honda, right? So I mean, like, you don't need to sit there and spend thousands upon thousands of dollars on equipment. Just get into it. It's the same thing with like 3D printers and stuff. You can buy a $10,000 printer, you can buy a $500 printer, right? But I think it's Rick Ferguson's down in Florida, like down in Fort Lauderdale, which reminds me, actually, I forgot to visit him when I was down there. But okay, he's probably get mad at me when he sees this interview. But I mean, that's what Rick said. Rick's like, just buy something, get started. And he's like, buy the $500 one and work it. And if it works, great. Go invest the $10,000 and get the expensive one. If you're barely using the $500 one and it's sitting in the equipment graveyard, then I mean, that's telling you something. But yeah, I just tell people, you can get into PRF relatively cheap. Incorporate in your practice, see if you like it, and if it's the case that you want to make that investment in more expensive equipment, go for it.
That's awesome. That's awesome. Well, you covered so much information today, and I appreciate that so much because I'm excited. I'm a little disappointed I don't get to take your course that weekend, but I will definitely be looking at taking another course. But what other, is there anything else that an attendee might learn about PRF in your course before I let you go today?
So namely, we're going to go over the history. We're going to go over the clinical indications, applications, talk about, like, I always say cases till you puke sort of thing. Maybe that's one of my Army background things. But we'll go over a bunch of cases and, applications where you're like, wow, I didn't realize you could use PRF for that. So, like, many times, people come in with sinus perforations and stuff, and, you can use PRF as a membrane to close a sinus. And people are like, you can do that? I'm like, yeah. Dry socket. People are like, dry socket? I'm like, yeah, what's the problem with the dry socket? There's no clot in there. So take a clot, put it in there, right? And they're like, I never thought you could do that. So, I mean, there's tons of applications that are available to you. So we're going to go over that. And most importantly, we're going to go over venipuncture technique and the hands-on component, teaching people how to draw blood out of people. Obviously, everyone's going to come out of there a novice, but like we say with everything else, practice, practice, practice. That's why there's mothers-in-laws, right? You get to mother-in-laws, father-in-laws, or whatever, in-laws, right? Like cousins, right? That sort of thing. To practice on family members and stuff like that, or people you don't like. That's a joke. I'm just kidding, by the way. Don't practice on people you don't like; they'll sue you, right? So yeah, your family members, your mother will never sue you, though.
It's true. That's awesome. Well, thank you so much for your time today. I really appreciate you giving us the time to kind of give us a preview of this course. I know you're teaching other courses as well, and I'm so excited to have you on the program. So thank you so much for being here today.
My absolute pleasure. Thanks for having me today.
Of course.